I know this may sound a little extreme, but if you're always hungry, always inflamed, always tired, 30 days without carbs can quiet the noise fast. By the end, you'll know exactly what changes to expect, why they happen, and how to handle week-by-week shifts. Most people feel a difference in 7 to 14 days. And if you're new here, hi, I'm Dr. Tony Hampton, board-certified family and obesity medicine doc with a master's in nutrition and functional medicine, a carnivore doc who meets people where they are. Now, one of the reasons I became a carnivore is because I didn't want my life to be ruled by cravings and crashes. And if you're a carnivore as well, do me a favor, because we have a lot of people who need to hear this message. Share the reason you decided to adapt this dietary pattern. Carnivore works because removing carbs resets insulin and satiety signaling. Your metabolism finally hears itself think. Now let's take a moment and talk about the mechanisms in plain English and take a deep dive into what happens when you remove carbs. Let's start with phase 1, hours 0 to 48. Insulin falls, glucagon rises. With carbs gone, insulin, the storage signal, drops, and glucagon, the release signal, nudges the liver to let fuel out. Eventually, you end up with glycogen depletion. Your liver burns stored glycogen, your carb reserve, to keep blood sugar steady. Each gram of glycogen stores 3 to 4 grams of water. So as glycogen falls, water and sodium are excreted. That's the early weight loss you see on the scale. Natriuresis of carb restriction. Lower insulin unlocks the kidney's brake on sodium excretion. So you pee out salt and water. Solution: add salt and electrolytes, or you'll feel weak, headachy, and crampy. Phase 2 is days 2 through 7. That's when you turn on fat burning and calm the appetite circuits. Lipolysis ramps. Lower insulin frees hormone-sensitive lipase and adipose triglyceride lipase to mobilize fat from adipocytes. Free fatty acids go to the liver to become ketones, beta-hydroxybutyrate and acetoacetate. Ketone availability rises. The brain starts using ketones for a chunk of its energy. This stabilizes neurotransmitters, more GABA, adenosine, tone. So many people feel calmer, focused instead of jittery hunger. Appetite hormones rebalance. Protein and fat boost PYY and CCK, leading to fullness, and lower ghrelin spikes, the hunger hormone. As insulin variability shrinks, leptin signaling, the satiety from body fat stores, gets clearer. Translation: fewer snack urges, simpler meals. Now let's go to phase 3, days 7 through 21. Inflammation quiets and your mitochondria gets efficient. Lower inflammatory signaling, removing sugar, refined starch, seed oils, and common irritants. Reduces nuclear factor kappa B activation and downstream cytokines for many people. Joints, skin, and gut often feel calmer. Mitochondrial efficiency improves. Higher fat oxidation and stable ketones nudge AMPK and PGC1 alpha pathways toward better mitochondrial biogenesis. You get smoother energy and fewer afternoon crashes. Gastrointestinal reset. Less fermentable substrate can reduce bloating in sensitive guts. Bowel patterns may be odd the first week, then stabilize as bowel flow adapts, and you settle on the right fat-protein ratio. Phase 4, that's days 21 through 30. Metabolic rhythm and cardiometabolic signals change. Triglycerides down, HDL often up. With carbs gone, de novo lipogenesis, which is making fat from sugar, slows. VLDL output drops. In fasting, triglycerides typically fall. HDL often rises. LDL patterns vary. Some see no changes. Some, especially lean active hyperresponders, see LDL rise from faster fat trafficking. Context matters. Don't panic from a single snapshot. Blood pressure trends. Lower insulin reduces kidney sodium retention and sympathetic tone. With adequate electrolytes, many see blood pressure drift down, which is why blood pressure meds may need adjustments, so coordinate with your clinician. Glycemic stability. Lower insulin resistance leads to tighter glucose swings. Diabetics often need medication reductions as readings improve. Now let's talk about cross-cutting adaptations you'll feel and how to steer them. Number 1, electrolytes and hydration. Low insulin leads to salt loss, so you'll need to replace it. Weeks 1 through 2, 1 1/4 to 2 1/4 teaspoons daily. That's approximately 3 to 5 grams of sodium. Up to 3 teaspoons on sweaty, active days. Add magnesium glycinate 200 to 400 milligrams at night if cramp prone. Stop fluids 2 to 3 hours before bed to protect sleep. Number 2, thyroid signals. T3 may drift lower with improved metabolic efficiency. If energy, mood, and temps are good, that's not hypothyroidism. It's fuel economy. Number 3, cortisol. Early adaptation and undersalting can look like stress. Solve sodium. Keep caffeine earlier in the day and stabilize sleep. Number 4, uric acid. Ketones and urates share transport in the kidneys. Uric acid can bump temporarily in early ketosis, then normalize. Usually not a clinical problem unless you have active gout. Number 5, bowel flow and fat digestion. More dietary fat means more bowel release. If stools are loose, try slightly leaner cuts for a few days, then re-add fat slowly. Number 6, your microbiome. You're not destroying it. You're changing your inputs. Many with IBS type symptoms improve in 2 to 3 weeks. That was my story. Some will reintroduce plants later, one at a time if desired, and then track their response. For me, I prefer to live as a carnivore. Number 7, hunger and satiety learning. 2 protein anchored meals, no grazing, teach your hypothalamus a new rhythm. Over 3 to 4 weeks, ghrelin pulses align with your new meal times. All right. Now let me summarize in plain English. Dropping carbs leads to your insulin going down and your glucagon going up, which leads to glycogen and water out, which leads to salt loss, so replace it, which leads to fat mobilize, which leads to ketones rise, which leads to appetite calms, which leads to your energy steadies, which leads to inflammation often quiets, which leads to your triglycerides fall, your HDL often rises, which leads to glucose variability shrinking, which leads to you getting simpler hunger and better metabolic signals. Okay, some of you may be thinking, carnivore works because it's extreme, but the more accurate statement would be, it works because it removes the biggest drivers of insulin spikes: appetite, chaos, and inflammation, sugar, refined starch, seed oils, and snack engineering, so hormonal signals can normalize. So if a patient came to me and wanted to try carnivore, what would I say? I would start with saying, maybe have 2 meals a day. Ruminant meat, beef, lamb, bison, eggs, seafood, cook in tallow, butter, salt. Generously salt your food. 1 1/4 to 2 1/4 teaspoons a day. That's approximately 3 to 5 grams of sodium. And use magnesium 200 to 400 milligrams at night if needed. I would make sure to emphasize hydration, 2 to 3 liters a day, or at least make sure your urine is a light yellow tinge. Stop 2 to 3 hours before bed. Caffeine, finish by noon. And I would definitely pause or reduce sugar, grains, seed oils, alcohol, late night eating, and keto treats. What would I tell them to measure? Not just the scale, their waist weekly, energy and cravings on a scale of 1 to 10, their blood pressure if hypertensive, CGM and finger sticks if they have diabetes, plus the belt notch test. Week by week expectations, ultra tight. Days 1 through 3, water drops, salt up to avoid keto flu. Days 4 through 10, cravings down, energy steadier. Days 10 through 21, sleep, mood often improve. Days 21 through 30, appetite is simpler, and your body composition trends show up even if scale lags. With any dietary changes, there will be struggles. Night shift, tie meals to wake cycles. Last meal 3 to 4 hours before main sleep. Constipation or loose stools, usually electrolytes or fat ratios. Adjust salt fat and give it a week. If you're having a dairy stall, pull cheese or cream for 2 weeks and reassess. And when it comes to exercise, keep week 1 easy. Strength usually returns by week 2. Cholesterol scare, it's one data point, it isn't destiny. Interpret over time and in context. And ask for a cystatin C with creatinine to estimate kidney function. Higher creatinine from muscle meat can falsely look like reduced function. Cystatin C provides balance. And if you found this video helpful, tap like so it reaches more people drowning in cravings and fatigue. And of course, subscribe for more root cause low carb carnivore content. You're not meant to white knuckle willpower all day. Give your body 30 quiet days. No sugar shouting, no seed oil static, just foods your biology recognizes. Imagine walking past snacks like they're invisible and finishing your day proud, not punished. Take the next right bite, then the next. Your results will do the convincing. And if you need more convincing, just read the comments. And although my videos are not medical advice, it's important that you understand the healing power of a carnivore diet. So if you take meds, especially for sugar or blood pressure, loop in your clinician as things improve. All right, for my carnivore curious, if you're ready to remove carbs for 30 days, click here for a video that gives you more information on how to get started on a carnivore diet. You now have the knowledge to start your journey. I'll see you in the next video.